Hello all, today we are going to discuss about Raynaud's disease. So this is also called Raynaud's phenomenon. So Raynaud's disease is a recurrent vasospasm of the fingers and toes and usually occurs in response to stress or cold exposure. It is named after Macquarie Raynaud, who was a medical student, defined the first case in 1862. The Raynaud's phenomenon is used to refer to localized intermittent episodes of vasoconstriction of small arteries of the feet and hands that cause color and temperature changes. The disease is most common in women between 16 and 40 years of age. It occurs more frequently in cold climates and during the winter. Classification, first of all we can see about primary. It occurs of vasospasm alone with no association with another illness. Then secondary to other conditions, most commonly an autoimmune disease, systemic lupus erythematosus and rheumatoid arthritis. Then predisposing and precipitating factors. Risk factors include working with vibrating machinery. The fingers may go into spasm. This is due to an intermittent lack of blood supply to the fingers, emotional distress, exposure to the cold. Women affected more other than men. Exposure to chemicals such as PVC, silica, smoking and autoimmune disease. Then pathophysiology. In predisposing factors, age between 15 and 40 years old, gender, women are mostly affected, then climate, winter. Then smoking, working with vibrating machinery, emotional distress, exposure to cold, women are affected more often than men. Then cold exposure, stress, digital artery contraction spasm, occlusion of arteries and tissue ischemia finally. Then signs and symptoms. The attacks can affect the fingers and toes and rarely the nose, ears or lips. The affected body parts will usually have two or more of the following changes: look pale due to lack of blood flow, look bluish due to lack of oxygen, feel numb, cold or painful, redden as blood returns to the affected area. Patients often describe three phases of changes: initial white, that is vasoconstriction, followed by blue, cyanosis, then red, rapid blood reflow. Then we can see about diagnosis. History collection. First of all, here we should obtain a history of an injury or frostbite. Occupational history, example, jackhammers, industrial exposure to polyvinyl chloride and autoimmune disorders. Then in physical examination, observe the color of the digits also. Examine nail fold capillaries under magnification, help diagnose underlying autoimmune disorders. Then laboratory investigations. Here we should do complete blood count, ESR, anti-nuclear antibody, may be positive in autoimmune disorders and should be obtained in patients with features of these disorders. Then rheumatoid factor may be elevated in rheumatoid arthritis, other autoimmune disorders. Then medical management, avoiding the particular stimuli, example cold and tobacco that provoke vasoconstriction. Then calcium channel blockers, example nifedipine, 30 to 120 mg of extended release formulation taken once daily. Then topical nitroglycerin 1% or 2%. Then management, the client is encouraged to avoid exposure to cold, avoid repetitive hand movements and stressful situations, quiet smoking and avoid secondary smokers as nicotine is potent vasoconstrictor. Then stress management technique, biofeedback assist in alleviating some distress from the condition. Thank you.